Has your cat been scooting, licking excessively, or giving off a strong fishy smell? These signs could point to a problem you might not have considered. They're anal glands. Hi, I'm Lyndall from Vetster, and in this video we'll go over what anal glands do, how to tell if your cat needs them expressed, what can go wrong, and what to do if they need help. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's hand it over to the experts.
Cats have two tiny anal glands, one on each side of the anus just under the skin. These glands produce a thick, strong-smelling fluid. Normally, this fluid is released when your cat poops. It's a way for them to mark their territory, but when those glands stop working properly, the fluid builds up, leading to impaction, infection, or even rupture. So how do you know if something's wrong? The signs aren't always obvious, but there are a few red flags to watch for. The most common sign is scooting, or dragging their rear on the floor. While this can also be caused by parasites or allergies, anal gland irritation is a top suspect. You might also notice a foul odor, redness, or swelling near the anus, or your cat aggressively over-grooming and biting at their tail base. In more painful cases, your cat might struggle to poop, have blood on their stool, or cry out in the litter box. If you see these signs, it's time to investigate the underlying cause. Anal gland disease typically progresses through a few specific stages. The most common issue is anal sac impaction. This happens when the fluid inside becomes too thick to drain naturally. The glands swell up and become uncomfortable, which is usually why the cat starts scooting. If the impaction isn't treated, it can escalate to an infection or an abscess. Bacteria get trapped in the gland, creating a pocket of pus. This makes the area hot, swollen, and extremely tender to the touch. If the pressure continues to build, the gland can rupture. The skin breaks open, leaving a raw, draining wound that's extremely painful and requires immediate veterinary care. Finally, though it is rare in cats, we also have to consider cancer, specifically adenocarcinoma. These tumors often mimic infections, showing signs like swelling and firmness. But they're aggressive and need a specific diagnosis. Diagnosing the problem starts with a rectal exam. Your vet will check for firmness, swelling, or open sores. If the tissue is suspicious, they may recommend blood work, fluid analysis, or a biopsy to rule out tumors. Once diagnosed, the treatment depends on severity. For simple impactions, your vet will manually empty or express the glands. If there is an infection, they will flush the area and prescribe antibiotics and pain relief. A quick but important note: you might be tempted to express the glands at home. Please don't. Unlike dogs, healthy cats rarely need manual expression, and doing it incorrectly can cause severe pain or even rupture the gland. This is a procedure that should always be handled by a professional. If your cat suffers from chronic issues, treatment isn't just about the glands. It's about overall health. Underlying issues, like obesity or chronic diarrhea, can prevent the glands from emptying naturally. Managing your cat's weight and ensuring their stool consistency is healthy are key steps in preventing recurrence. In severe, recurring cases where medical management fails, surgical removal of the anal glands may be the best option to keep your cat pain-free. If you're staring at your cat's rear, wondering whether that swelling is an emergency, don't guess. These symptoms can be painful and escalate quickly. Book a virtual appointment with a Vetster veterinarian today. We can look at your cat via video, assess the severity, and tell you exactly what steps to take next. Thanks for watching, take care, and we'll see you in the next video.